Our next topic is very important to talk about because the statistics are overwhelming and the impact on families is absolutely devastating. I'm talking about mental health issues, including depression and prescription drug abuse in our aging population. Sometimes this can even be due to physical conditions that are left untreated, but our guests today have a very unique approach to this ongoing problem. Dr. Charles Cutler is the Chief Medical Officer for Magellan Complete Care, one of the divisions of Magellan Health, and Dr. Fatimah Tahil is the Medical Director for Magellan Healthcare, the company's behavioral health business. They're here to share with us some of Magellan's unique approach to supporting mental health concerns. So, welcome. Thank you for coming. And Dr. Cutler, you know, we all like to think of baby boomers as moving into the golden years and how wonderful it's going to be, but mental health issues can be a real hidden problem for people to deal with. Isn't that true?
Yes, Morgan. While most people are happy in their golden years,
really?
I'm happy. About 1 in 5 people have a mental health condition that goes unrecognized often. Many people don't realize that the anxiety that they're feeling or the depression or feeling blue isn't normal. Other people may still sense that there's a stigma around having a mental health condition and not acknowledge that one exists. And many physicians don't actively screen their patients for mental health conditions. So the unfortunate effect is that of that 1 in 5 people, many people are suffering in silence for something which is eminently treatable.
Dr. Tahil, I think we all know someone who's struggling with this kind of issue. So what can be done?
Magellan has taken the opportunity to actually bridge the gap between medical care and behavioral health care. What we do is we're able to assess someone's psychosocial needs, biological needs, and take all that into consideration as we view that individual as a whole person rather than any singular aspect.
So I think what you're talking about is integrated health care. What does that mean exactly to Magellan, beyond what you were just describing?
So one of the things that we know is that there is a link between stress and health. That fact has been established for a long period of time. The fact is, as you mentioned, that there are people who suffer from mental health symptoms, but they don't usually get the treatment. And what we do is we know that psychological stress in and of itself can actually trigger physical illness, and in fact can, for some people, exacerbate chronic medical conditions such as diabetes or chronic heart problems. And what integrated healthcare does is it allows us to actually identify these symptoms much earlier on and in fact help us create those processes wherein those symptoms can be treated easily and faster, so that in essence what we're doing is reducing the intensity of care and probably the duration as well for the treatment that might be required.
Well, that sounds great, because I think a lot of people don't realize that some of the depression and anxiety are actually symptoms of the disease. What are some of the specific mental health issues that you see with baby boomers and sort of the population in general?
One of the big issues is pain. As people get older, they develop problems, in particular problems,
tell me about it.
problems with their muscles and their joints. Arthritis is very common in the older age group. Musculoskeletal problems with muscles and joints are so common that it accounts for almost $900 billion a year in healthcare expense. But even more important than that, there's a personal toll that comes along with having those kinds of problems. When people have arthritis and have trouble moving, they don't do the kinds of things that they enjoy. They don't get out to be with their friends, they don't visit family. They may even have problems doing simple daily tasks like cooking for themselves or going shopping. So what we try to do is address all of these things together. When you have these kinds of problems and you don't have the social connectedness, the ability to be out with other people, you feel isolated. And when you feel isolated, you're more likely to feel depressed and hopeless. And that's something which we can treat by, again, a combined approach.
That is an enormous cost to the whole population. Those numbers are huge. How does Magellan help not only with the cost of the treatment, but with dealing with this kind of pain?
Well, Magellan has a program called Musculoskeletal Management Solutions. And what we do is work with the individual who has the problems and the providers who are treating them. So the good news is that many of these conditions, arthritis, for example, can be treated easily with fairly common and low-risk kinds of interventions. For example, yoga or physical therapy or over-the-counter medications are often effective in treating people with arthritis. I think many people, when they develop joint pain, think about having joint replacements or surgery, but really the vast majority of people do well with common, less risky kinds of interventions. People with low back pain, for example, get better over time with these kinds of treatments, so that 60% of people get better in 2 weeks and 90% of people get better in 12 weeks without anything more aggressive. And if they do need more aggressive therapy, by having the initial physical therapy and other treatments, they're in much better shape if they do need to have surgery, and they're ready, much better prepared for recovery after surgery.
I hear a lot about the increased use of pain medication among baby boomers. And what kind of risk does that put people at?
So, Morgan, 1 in 3 Americans actually suffer from chronic pain. And in fact, over 50% of older Americans report chronic pain symptoms. So we know pain is an issue. Fortunately, a lot of people who are taking these pain medications are really not aware of the fact that they can potentially get addicted to these pain medications. And so if you think about that, the issue of pain medications has been increasing, has been on the rise, and over the past 7 years or so, there have been an increase of over 180% of opioid use. So that means that we as a nation are currently spending over $55 billion just in healthcare costs. But more alarming is the fact that 50 people die every day from opioid prescription drug overdoses. Now that number far exceeds the number of people who actually die from motor vehicle accidents.
That's just terrifying. That is absolutely terrifying. How is it that so many people find themselves on the road to addiction?
If I can give you an example, if we think about a baby boomer, for example, who may be in pain right after hip surgery, he takes medications as prescribed, but because the pain's not well controlled, he continues to take more medication. So the one extra pill becomes a second pill and a third pill, and the next thing you know, he's taking much more than he's actually prescribed. And as he's doing this, and he's starting to realize, oh, my pain medications are actually helping me sleep. So next time he has a problem with sleep, he takes a pain pill, not for pain, but for his sleep. Additionally, he also starts to realize that his anxiety can also be alleviated by his narcotic pain medications. So now we start seeing a misuse pattern that he's starting to engage in. And so he thinks that what he's doing is relatively safe. It's a safe action plan, but in actuality it's not. It's actually putting him at significant risk to becoming addicted to opiates, especially as he moves to taking more and more pain medications, using pain medications that are not actually prescribed for certain symptoms, as I described, and he can really get himself into significant trouble.
So what is Magellan doing to sort of help educate people and fight this prescription abuse?
So Magellan has what we call the prescription drug abuse solution. This solution is really designed to prevent anyone who's on prescription pain meds from becoming ever addicted to these narcotics. We believe that meeting the member or the individual before addiction happens is absolutely crucial. So our solution provides educational information. We want our patients or individuals to be educated about the risk of pain medications so that they can actually improve their health literacy. By doing this, they're able to make better choices and better determinations in as far as their health care is concerned.
You know, there are so many important related issues to mental health. What expertise does Magellan bring to help deal with all of that?
As the Surgeon General David Satcher said, there is no health without mental health. And when it comes to healthcare, there's no substitute for expertise. For the last 40 years, Magellan has been providing that expertise to help people with mental health problems. We know that people are on a journey with regard to their health care. They're challenged by conditions like emphysema and diabetes and arthritis, as we've discussed. And those conditions can trigger mental health concerns as well, and they can be impediments to managing physical health and mental health conditions. So we are working together with providers, primary care providers, and others to identify mental health conditions early, start treatment early, and take care of the whole person. We're trying to help manage this journey that all of the members and patients go through and provide the best possible outcome in the most holistic way for our members.
Well, Dr. Cutler and Dr. Tahil, thank you so much for being on today. This is great information that I think all of the baby boomers aging and getting into these problems should hear about, because the risk of addiction is so perilous and so strong with these medications. Thank you for being here.
Thank you, Morgan. It's
Thank
been
you,
a
Morgan,
pleasure.
for having us.
Thanks. And for more information on Magellan Healthcare and its mental health programs, visit magellanhealth.com or log into babyboomersinamerica.com.